Hello, and I'd like to welcome you all to the webinar. The webinar today is focused on men's mental health in Ireland today. So I would like to first welcome Cillian on just to go over the housekeeping, and I believe there's a few things you'd like to say first, Cillian.
Perfect. Thanks a million, Bill. Delighted to be here. My name is Cillian and I am the Peer Education Training and Development Officer with Midwest ARIES. So just a little bit of a housekeeping before we do the introductions. The format of today's webinar is 1 hour. There is a Q&A button at the end of your screen there where you can start inputting questions now or even throughout the webinar as the discussion goes, and we'll hopefully be able to answer all of them if we can throughout the webinar itself. Other than that, we'll have signposting throughout the end of the webinar as well. And additionally, you'll get a learner pack with more information and resources at the end of the week with this recording as well, and the podcast link as well. Also, a feedback form will be put in at the end of the webinar to get your thoughts and opinions on this webinar series, because it's always great to have this partnership with Mental Health Ireland on the ongoing webinar series over the last while as well. So today's topic is on men's mental health in Ireland today. I'm just really looking forward to the discussion. It's going to be a great one, and hopefully we can spread more awareness on this important topic as well. So Bill, I'll pass it back to you if that's okay.
Lovely. Thanks very much, Cillian. And just to say that this is a joint production between ARIES and Mental Health Ireland. So first of all, myself, Bill Vaughan, as I say, I work with Mental Health Ireland, and I would be one of the development officers around the county. I will be kind of hosting the discussion today. This is the first time I would be hosting one of these, so bear with me. And I have a mix of different panelists who all, in their own way, would work in the whole area of men's mental health. So I am looking forward very much to discussing the whole topic. So first of all, I'm going to welcome back Cillian, who is on the panel. I'm delighted to have him. Cillian, you've introduced yourself, so I won't ask you to do that again. I would like to welcome Michael Mongan. So, Michael, how are you doing? Maybe you could say a wee bit about yourself, what your role is and what you do.
Yeah, sorry, there's just somebody in the room. Yeah, I'm Michael Mongan, so I'm the men's health worker here with Donegal Children's Project, and basically, it's I suppose what I do is kind of in the job title I do. I work with child and men around Donegal, and so we work around different initiatives and stuff like that. We any kind of initiatives we are running and kind of programs, we try and cater around the needs of the community in Donegal. So that's kind of a small bit of what I do.
Brilliant, brilliant. Thanks, Michael. And just to say that there is another panelist, Paul Gibson, who works with GROW, who hopefully will be joining us. He had a meeting beforehand, but we're hoping he'll be on soon. So, lads, thanks very much for joining us. Just to say, we're not long after Men's Health Week, which was in June, I think around the middle of June, and ended on Father's Day. I have some questions here that will kind of guide us, but we may, as I would say in skiing, we may go off piste now and again, but I know you can handle that, whatever's thrown at you. And the whole area, first of all, of men's health in Ireland today, you know, what would you say around that, Cillian, in your own opinion?
Yeah, I suppose there's a lot more awareness around men's mental health over the last number of years. Lots of different initiatives, organizations, and services being created. But I think for us, I'm working as the Peer Education Training and Development Officer with Midwest ARIES. So we do recovery education workshops around the topics of managing anxiety, let's talk depression, resilience, creativity for well-being. So we have a wide range of workshops, face-to-face and online, and in the acute psychiatric units in Ennis and Limerick, that I suppose give people the tools and knowledge around what they can do for themselves in their own recovery journey, and to help them along that path to get better and stay well and maintain their mental health and well-being. But I think overall, in general, men's mental health Ireland, I think it's getting better. More people are being open and honest about their own challenges, and that helps other people as well. That helps broaden the conversation, that gets people more aware of mental health in general. And I think it is getting better bit by bit. But there's work still to be done as well at the same time.
Right. Well, that's positive. It's kind of good to hear that. That it's getting better bit by bit. Michael, what would you think?
Yeah, look, I think we know mental health, is pretty bad all over the country for everybody at the moment. But I think with travellers, we see a lot of big problems now. Like we look at the suicide rate, it's 7 times higher than the general population. 11% of all traveller deaths are through suicide. So, but again, we are kind of where there was a stigma around talking about mental health within the community, because so many people are affected about it. You start to see a lot of people are starting to open up more about their mental health, and they are kind of more accepting about when people are talking about their mental health too as well, and less judgmental around those things. So that's kind of positive. But yeah, there's a lot of big issues around the community still at the minute, but there's a lot of work to be done. But again, that's what these are for, to kind of try and help people the best we can,
Yeah. It's just, it's interesting hearing the two of you speak around that, because when we're talking about a subject like this, you have generally, how is it, and then you can have a kind of specific where you look at a subgroup. You mentioned there, Michael, the traveller men, and the challenges that they would face, and statistics then that would back it up, like you say, their suicide 7 times higher, which is a challenge for not just that group, but if we look at public health in general, what's been done for specific groups of men, say, with regards to Donegal Travellers Project, what kind of things is the project doing to support, to help men who may be struggling with their mental health?
Yeah, so again, as I was saying earlier, like we try and cater around the needs of the community. So if we're going into a certain area to work, we try and hold consultation groups. We bring a group of men together or whatever, and we see, look, what are your needs, and we try our best to kind of cater around that. So at the minute, kind of stuff that we have going on now is we do a traveller men's football once a week, and then once a year, then we do a big game which you referee just to yourself. We do individual work then, which is individuals, which is like walk and talks. Which is really good, really successful too as well. So then we do targeted trips as well around positive mental health. Another great thing that actually happened within the county now, within the last year, is that we had the research is done by travellers for travellers, and it was about travellers' experiences with the services in Donegal, and basically they talked about all their negative experiences and kind of how they felt using services, and what they came back out of that was a lot of actions and recommendations to try and improve the services in Donegal for the travellers that are accessing them and make them more culturally appropriate. So that was another great thing that came out of from the kind of work we're doing, and there's a lot of the men.
Oh, you've just gone mute there.
Yeah, so I don't know what happened there. No, but there was a lot of men from the project here that was involved in that there. We were part of the advisory group. We went around and identified the men to be involved to make sure there was a wide caption that you got. We looked at men over a certain age. We looked at men that had been in prison, men that had experienced homelessness, all different kind of backgrounds, LGBT, and we just to get everybody's opinion to make sure that when we do come out with these recommendations for the services, that everybody was going to be included. So yeah, that's another great thing that I think we've done in Donegal ourselves.
Yeah. So listening to that, it's not just kind of random going out and putting out fires kind of thing. It's there's a lot of research done, a lot of pre-planning done, a lot of strategic work to see how best to tackle these things. Like Cillian, then I'm just wondering, with the colleges, the recovery colleges, and any say workshops or that, how do you find the uptake from men compared to women?
It's a wide range of mix, really, Bill, to be honest. I think, like I was saying at the start, the more awareness has been done and the more knowledge people have around recovery, they're willing to learn about and educate themselves to help them on their recovery journey. And I think there's so much information out there and so many good services as well, that I think it's making a massive difference in people's lives, even without us sometimes even knowing it. You're making that difference even for people to attend a workshop once off, or come into 3 or 4 or 5 workshops in the community. And it really does, from the feedback that we get, it's amazing to see that people feel empowered, they feel connected, they're building meaning and purpose in their lives, you know, day to day, week to week. And that's what it's all about. It's making that difference to people who use our own services, and just to be a positive part of change going forward as well. And I think, just to go back to what Michael was saying about meeting the needs of in the community as well, all of our workshops are co-produced by people with lived experience of mental health difficulties, their family members, carers and supporters, and staff working within the services as well. So everyone has a voice in our creation process, the co-production process in our workshops as well. So we're meeting the needs of people in the community as well. And it really does make a massive difference that people have a say in what goes into the courses, and they feel part of the process as well. So I just wanted to add that as to what Michael was saying as well, you know. So yeah, thanks.
Yeah. Bill. And how do you see that then, you know, the massive difference it makes? In what way do you see that coming across?
I suppose we evaluate all of our workshops as well. So we see from the feedback and just from general people in the workshops how they feel after. So we have the CHIME framework that was, it's connecting hope, identity, meaning, and empowerment. So that's just kind of model that we use to do our evaluation. And you just see people, the response rate from that is more or less positive, because they can see how the benefits of attending a workshop can help them in their recovery. And it might be one small piece of knowledge that they get from one workshop, but they can implement, and it's actionable in their own life as well going forward. So they can take something from the workshop and bring it forward to their own life as well. So it's usually that kind of feedback that we get, you know. Yeah,
and that's a big part of the recovery thing, is to have, you know, empower the kind of the service user, empower the person that's in recovery, and it's a big part of what we do in Mental Health Ireland as well, is to get things co-produced. And I don't know what you two would think about that, but you know, I see much more of that in the last, you know, 5-6 years, where when there's maybe funding opportunities, or where there's groups coming together, that you see it's more natural to have a co-produced way of going about things. Would that be the case?
Absolutely. I think because people know that they have a say in what goes into the modules as well, and it really makes a difference because they feel they're respected and valued. And you know, like if I was part of a co-production process, I'd feel empowered that I could give some piece of knowledge on my own experience through my own mental health, and that it can be put forward and help other people down the line as well, you know, in the workshop creation. So yeah, I think it does make definitely makes a difference.
Yeah. Have you been working in this field for a good length of time?
I suppose I have been with ARIES this is my 3rd year now. So I kind of had my previous own personal training fitness business for a number of years as well, but kind of doing the well-being area as well, public speaking on mental health. So I think I've learned a lot over the last few years what has helped people along the lines of mental health, and using my own past experience as well to just instill that hope that recovery is possible over time as well. Whilst being in the midst of difficulties, it can be very, very difficult, but that's what all these, I suppose, conversations that we're doing today is, to spread more awareness at the same time, you know, Bill?
Yeah. Okay, another question then. In the whole, well, we've kind of touched on this anyway, but in the area of men's mental health in Ireland, what would you see as going well?
Going to me come into that, or Michael, Bill? Like, man?
If you go first there, Cillian, I don't know if
Yeah.
did you hear that, Michael? We'll just check. I'm just asking Cillian what's going well in the whole area of men's mental health in Ireland today. So have a think about that. I'll go to Cillian, then I'll come to you.
Perfect. Yeah, like I think I mentioned, like there's so many different initiatives now in the area of mental health and well-being as a whole. Like even the men's sheds, there's more men's sheds popping up all over the place as well, all over Ireland. Even in workplaces, there's more emphasis on health and well-being in general, like stress management. There is more, I suppose, workplace initiatives like fitness classes. There's different things like nutrition. So it all has that holistic approach to enhance a person's mental health and well-being, and contributes not only in their work life, but in their personal life as well. So it has that compound ripple effect day to day in their own lives. So yeah, I think there's lots going on. Like, you know, it's just, I suppose, just being made aware of what's out there at the same time. You know, there's probably hundreds of organizations around Ireland, but again, it's just knowing what you need at the particular time, and different organizations that's there as well.
Yeah. You mentioned a few kind of physical things there.
Yeah.
And I saw in a report there recently where, you know, people were asked what they think benefits their mental health most, and exercise would have been, particularly with men, what they would that would be their go-to in relation to something that then also helps their mental health as well. Michael,
Sorry, yeah.
Sorry, yes, Cillian, go ahead.
No, I absolutely, exercise is a key component, and I'd be lost without exercise, even if it's just a walk out in for 20 minutes or half an hour in nature or something like that. Just has that effect, positive impact on my own mental health and mindset day to day. So it definitely does make it. And it doesn't have to be like, exercise could be gardening, it could be housework, it could be anything at all that's unique to the individual that will help them along the way.
Yeah. I do the old park run not every week, but I would try to do it as much as I can, the park run, and I would just walk it. I don't even run it. A lot of people think, oh, park run, now sure, I don't run, but there's in Letterkenny there's a good few people who walk it as well, and it's a great way to get up and at it on a Saturday morning. Michael, what's going well in men's mental health in Ireland?
Yeah, I think you touched on a lot of things there now yourselves already. Again, kind of going back to that physical activity. I don't know if I was in England a few years back though, they did this where they prescribe exercise to people suffering with mental health, and I think that'd be a great thing to see happening in Ireland now too as well. I think, because I think we all know the benefits of it, you know, and you see, as you said there, most men, when it comes to that there, they would describe physical activities as a great benefit. Another great thing, I suppose, what we are seeing is how easy it is, like all these mental health apps that you can download now, like meditation apps. There's all these. I think there's one there, Headspace, which is really good. I actually seen it as well. I think it was even on Netflix for a while, where they had their own like program on Netflix and stuff like that, Headspace, with all the sounds and the meditation and stuff like that. So you are seeing a lot more kind of out there, kind of. It's been showed off a lot more around mental health, and again, I think it's helping break down the stigma of mental health. I think when you look at even like football clubs and going to the gym, guys talked about mental health years ago. There'd be all a joke and a laugh. There's a far more support around these issues now, especially within the sports themselves as well, like within teams, within everything these days. To be honest, like their supports, like, and it's good to see.
Yeah, that's you touched on the stigma end of things as well there, and I see there was a GA player was kind of talking about, well, there's been quite a few kind of in the last few years talking about struggles with mental health and that, which I think is good for other men to hear that it's okay to talk around that. So, you know, also the apps, you know, Headspace and that, one of the first I heard of that was my nephew was telling me about it. And so I kind of downloaded it to see, and I must say I found it very good. And there's plenty other kind of meditations. There's great podcasts too in the whole area of mental health, and they tie it in with sports people and things like that, which is a good way of it, you know, getting men to listen. listen to the things. Uh,
I'm in there, Bill, for a second. If just for the attendees, if they have any questions throughout, I suppose, this whole webinar, do input them into this Q&A button at the end. We'd be happy to answer any questions that people have throughout the remainder of this webinar. Just wanted to add that, Bill, if that's okay.
Well, certainly, yeah. The groups, well, I have to say the Donegal Travellers Project and the other group that was out yesterday with a big football match. They have an annual football match, and a great atmosphere. You know, and that's because they meet up regularly anyway. Every week they have a football match, but I just thought yesterday it was so positive. You know, the competitiveness was there. You know, it was they were taking the game seriously, but there was great respect, and you know, it's things you touched on earlier on, Cillian, about the men's sheds. You know, the men's sheds seems to be fairly strong all around the country. From what I see, I know in Donegal here, there's over 20 groups, men's health groups, and they kind of keep together in clusters for training earlier on this year, Sheds for Life training, and particularly in counties like Donegal, where it's kind of harder to get around unless you have a car. Public transport wouldn't be as good as in other places. That you have these kind of places to meet other men is great. You know, you've also the other initiative, Men on the Move. Would you have heard of that? Do you have that, Cillian? It's I think it's through the sports partnerships up here. Well, that's where the funding comes through, the sports partnerships. But that's another great initiative. You know, which gets groups of men together to exercise and also then, you know, maybe take in some other things, mental health, maybe looking at cooking, things like that. But it got a very good response here in Donegal when it came. You know, what about then the challenges? So, you know, what still needs to be done or what's not working? Michael, if I start with you there.
Yeah, look, challenges, I suppose there is, obviously we know already with the mental health services, there's a huge stress on them already. You know, they're overwhelmed with the amount of people that's trying to access the services. And because of that, whenever you are finished interacting with the mental health services, there is no follow up. There's none of that wraparound service, you know, to see how you're doing, how you're getting on. And I suppose that's a big challenge. And a lot of things we try to do ourselves here now with the community that's linked in with us, and we would try and get them into mental health services or GPs or whatever, is that because we know there's not that follow up, that we try and do that ourselves, that we'll be linking in with them saying, how are you doing today? Doing walks and talks, inviting them to football, creating events to get them out of the house, to get them out mixing and socializing with others. You know, so that's one of the challenges that we see, is that there's no follow-up services within the mental health services, but we try to fill that gap in the best we can as well. But that's a big challenge that we're seeing as well, like how access it is, how hard it can be to access mental health services, and then getting the follow-up support after you leave them, which is tough.
And how do you find how's that working? You know, where you're kind of, you know, user checking in.
Well, look, obviously we're not doctors ourselves, you know, so we can only do so much, like, and we're kind of limited that if you're working with a man with mental health or whatever, it's normally a one-to-one. So it's hard to get them into big groups to kind of, so you're limited in the amount of stuff that you can do. Now it can be okay, and we do get a few men that do participate in it, but then there's some then as well that just kind of, they need the mental health services, and kind of what we can offer them is just not what they need, and they do, you know, so that's a challenge as well we do see, like, you know.
Yeah. So it sounds like what you're doing is a wee bit like the social prescribing.
Exactly.
Yeah. Which is great, because you know, you can give them time where maybe if they're going to the GP services, sometimes, well, they're the waiting list first of all, but then there's kind of time restrictions. and you would know a lot of the, you know, the supports that are out there, that maybe it could be that sometimes, not saying all the time, but sometimes that's all they need, is pointed to an appropriate community group service or something that's out there.
Exactly, yeah, exactly. And look, like it's trying to give them a safe place to go and socialize and kind of get out, where like a lot of mental health issues there, you see, they might be go turn to alcohol and kind of drugs and whatever other issues too as well. And we try to kind of give them a place outside of going to the pub, and give them a different way to try and socialize in a more healthy and a more positive way too as well. Like, so it's giving them a safe space away from all of that stuff as well, which we try to do as well.
Yeah, yeah. And would you find, have you worked up a kind of relationships with different services like that alcohol and drugs service, or the counselling services or stuff like that?
We do. We try our best to kind of know all the services in Donegal that's aware of the recommended, any kind of give and go, and kind of try and build relationships up ourselves with them. Again, some of the biggest issues is these services so overwhelmed themselves that they just haven't got space or the time there. But we do try our best to be linked in and be able to link them in into the right services that they need. Because again, if somebody's coming out and they're talking about their mental health, you know, and if they're going to somewhere and they feel like they haven't got help to what they want, that was already a big challenge for them to do that in the first place. And if they feel like they're being passed around, the second time they mightn't come back to talk about it again, you know. So you want to make sure you're linking them in with the right people from the beginning. And that's what we try to do, you know.
Lovely. Okay, thanks, Michael. Cillian, it's just to remind everyone, we're just looking at the challenges, what maybe not working as well as it could, or what needs to be done.
Yeah, I think we kind of talked about stigma earlier on, the pressure, you know, the stigma of opening up, and the pressure on men, I suppose, to be able to open up and have maybe the courage at times, and I think what tied on to Michael, find the right support at the right time as well, you know, find that right person that you can trust and confide in. And that can be really hard if you're struggling with your mental health for the very first time. I suppose you're trying to figure out what to do, what's going on, and where do I go and what do I need. So I think that stigma piece comes in, the pressure as well. And I think what's a major thing as well is the barriers, and there are many more barriers to seeking help as well. Like, it's about figuring out how do we tackle those barriers to people maybe afraid, the fear around opening up. There's so much in the mix really, and it's about trying to counteract people haven't, I suppose, been able to open up, really being able to see that they may have difficulties at present moment, and getting the right support at the right time as well. So I think that's a challenge, you know, a couple of challenges anyway.
Yeah. And is that something you think that's in our DNA as men? As you know, is that something where we've got to accept that this is going to take a lot of time, or is it something that, you know, do you think, well, it's a light bulb moment, a switch on moment where, all right, okay.
Good question. It's hard to know, hard to give a definitive answer on that, because I think, having my own challenges back in the day, I think I had that awareness around at the time, over time, to learn what worked for me. And now I do things in my own life that have a positive impact on my own mental health, because I've had that previous experience. So I know exactly what I need to do at the right time. So it could be meditation, exercise, eat healthy, go out for a walk, all those things, all the good stuff that we're told to do. But again, when you're in the midst of difficulties, that can be the hardest thing to do, to take one step outside the front door. So it's being, I suppose, self-aware of how you're feeling in the moment, and what would be the one step I can take to make myself feel a small bit better in the day. And it could be as simple as getting up and taking a shower. It could be as simple as just, I don't know, something, just getting out of bed in the morning. And that could be difficult for so many people as well, you know. It's just taking one step at a time. But I don't know, back to your question, I've probably gone around the houses now of that, but I don't know, it's hard to give a definite answer if it's in our DNA or not, you know.
Yeah, it's a good debate to have.
Yeah.
What I find, and I'd be interested to see what the two of you think, is like, we go around doing workshops, so it's for everyone. It's not specifically for men. And if I think down through the years, if I was to put percentage as to women that came and men came, I would say it's over 80% women, easily over 80% women that have come to the mental health courses, or mental health related courses, and at the most 20% men. Would you relate to that with the work that you do? If I go to Michael.
Yeah, I suppose like with women, like I wouldn't, like we do work with women here, but I'm kind of focused around men, so I don't see a lot of the kind of the comparisons between
Right.
the two of them. But I suppose feeding back into that, I suppose you could see where you'll be right, because like I think women just find it easier to talk about these things too as well. Like women will sit down at the table and they might turn on and say, over a cup of tea, and they're like, "Oh sure, he's after doing that today. Now he's really winding me up," or whatever. And they'll sit there and have a backbite, and then they'll move on and they'll feel better for that. Where men don't sit down and they don't vent and they don't get that out, and they kind of hold it into themselves. And I think women are just better communicating these things with each other than men are, and that's an issue as well.
Yeah, yeah. Cillian?
Yeah, it can be hard, I think maybe when men are less open to share their thoughts and feelings and emotions from time to time. I haven't been saying myself at times, but I think, yeah, I'm always looking for a solution to that as well. I'm always looking to the why is it so hard as well, and kind of questioning, we're self-reflecting on why am I finding this difficult to open up about? Why am I finding this a barrier to talk about? And then it's kind of unraveling it in your own head and figuring out why is this so hard. And then sometimes I journal a good bit, like journal thoughts, ideas, whatever else. And sometimes writing on paper can really find the answers, because I think sometimes we have all the answers in our own head. It's just trying to unravel our thoughts, because we could be ruminating on things for days, for weeks, but it's trying to unravel those thoughts by talking to people, open up to someone you trust, journaling, or doing stuff that'll help the situation. So yeah, I hope that answers, Bill.
I can relate to the journaling. I would do that as well. I had done it years ago but stopped it, but I had a rough enough old spell there a couple of months ago, and I got back into the journaling, just writing whatever's in my head, and I just find it very helpful. Very helpful. It nearly like it shows you on paper half the stuff you realize you didn't know you were thinking about. And it's if that's healthy, that's fine. But if it's unhealthy thoughts, it's better off putting them out in paper and trying to get rid of them than having them going round the head all the time. That's what I found this time with the journaling. Very powerful.
Yeah, I couldn't agree more, because I think we have so many thousands of thoughts every single day, but getting something on paper. And I always say to people, write, journal if you feel, journal as if nobody is going to read it, and keep it private to yourself, because I think if you have the idea that someone else is going to read, you mightn't be true to yourself as well. So I always write whatever I feel at a particular moment, and then I might look back at it a week later and really see I can find a solution to what I was bothering me at the time as well. That's just amazing. That's like just really helpful for me going forward for my own well-being.
Yeah. And I think like what we're talking about here ties in with what you said, Michael, just a wee while ago about men find it hard to express this kind of, to talk about this kind of, talk about their feelings or their deeper thoughts. It's just outside their comfort zone. And then there's another one too, lads. We should discuss is the huge change for men and men's roles, gender roles in the last generation, or definitely 2 generations. No, I said generation, where if you think to back when you were young, and what life would have been like for a man then, compared to now, on all the different gender types now, a man, a man's role now is much less defined. Would you agree, Cillian?
Less defined.
I mean, you know, if you exaggerate, if you say we're no longer the hunter-gatherer, but we're, you know, now what's expected of a man is changing all the time. You know, a generation ago, the man would have been the main breadwinner. The man wouldn't have had much to do with the babies. You know, the man a lot of times wouldn't have cooked. Whereas, you know, is it now where it's more or less defined, shall we say?
I think it is different to many years ago, you know. Yeah, I think it is, you know. I think it's ever evolving. It's always going to be ever evolving. The next 50 years could be totally different again, you know. I think from my experience as well, like, I think it's nice to see the change as well, that there's things, positive things coming from that as well. There's more, I suppose, what's the word I'm trying to look for? You've caught me on the hop now. I'm trying to think of the right word. Like it's like with a relationship, it's more equal, more so than one person dominating the other or whatever else. I think it's more of an equal relationship between a man and a woman now, more so than anything else, maybe, if that's what I'm trying to say. You know, it's not, I don't know, maybe Michael has more thoughts. I might come back to me in a second. I'll have another think about it.
Right. Michael, over to you.
Yeah, I suppose, and the likes of when it comes to travelers and kind of what it was like maybe a generation ago, I think with travelers, they're still very traditional. They still have a lot of cultural stuff that they hold on to. So, and lines of the way things are, they haven't changed a lot. But I think where the cultural norms haven't changed, I think there's a lot more openness as well to a lot of stuff. What we are seeing, you know, I said around talking about your mental health, you know, like I suppose like with travelers, you would have seen a lot of religion, you know, and kind of stuck by those things, and I suppose a lot more acceptance around LGBT. There's more acceptance around mental health. There's even women, you know, they play bigger roles in the households now, you know, than they would have one time ago. But again, big changes, not a lot, no. But again, yeah, there are changes, but it's slowly happening, and I think it's this younger generation now that's doing all the changes and are pushing that kind of way. I think the more people are kind of staying in school and kind of access to the internet and seeing, you know, just being access to everything on your fingertips, I suppose, with your phone, you know, you can see how the world works, and it's not just that narrow-minded people, you know, kind of where you were just growing up and you were told something and that's what you believed. I suppose, like anyway, you know, it's not like that no more. You know, I think people they have to learn by themselves. You know, they become their own. What would you say that there? Like they can think for themselves if that's a way of putting it. But you know, they have that critical awareness around what's going on around them and stuff like that there, and their way of looking at things and the way they judge things are changing.
Yeah.
Yeah, no, I'll come in on that again because I have more thoughts on that. That's really good, Michael. I think I totally agree. That, like, with the internet and social media, the whole lot, you've so much knowledge at your fingertips as well to learn about absolutely anything. And that's going to continue for the next number of years as well. But and I think it could be positive in some ways, but negative in other ways. You know, there's different ways to look at it, really. You know, with social media, especially on men's mental or on mental health in general, the effect it can have on people. You know, the comparison to others or different, a whole load of different things can affect people's well-being with social media and the whole lot. I don't know, would you have any thoughts on that, Bill? And Michael, I'll throw it back to you.
Well, I would, having listened to the two of you, there's the HSE have a course, Engage Men's Health. I don't know if you've heard of it, and that's what it explores. You know, it's a day workshop for anyone who works with men, and it's very interesting because it brings up this kind of thing, you know, then and now, and it gets you thinking around changes for men, but then it goes into the determinants, you know, what affects all this, you know, what are the factors outside our control, but yet influence our views of being a man in today's world. And you touched on it there, Michael. With the traveller men and their group, about how what you see is, there's not there in ways, yes, there is changes, but in some ways, no, there's not changes, traditionally, and how, it all depends where we live. It all depends who we're with, what traditions, what rules we live under. But that the Engage course covers all that. So if anyone's works in a field that's listening and is interested in this whole area, if you just Google Engage Men's Health, you should find out where they're on and how you can do it. Right. What about, lads? Then I suppose we'll have to look at the help that's out there, support that's out there for any men who may be kind of really struggling in particular. What advice or where would you point those men to? What services would you highlight for those men? Cillian, if I go to you first.
I suppose the GP would be, I suppose, if someone is struggling with their mental health, maybe the first protocol might be their GP to have a conversation. Again, there is peer support groups out there. There's various kinds. There is, like I mentioned, the Men's Shed. There is obviously our Midwest Aries workshops on recovery education. So that's another aspect as well that people can delve into. But I think the first thing is to maybe try and open up to someone you trust first and foremost. If you feel that you're struggling at the start, and I think it's better to say something than not say anything at all, to open up about your own challenges, because I think it's a sign of strength, not weakness, to share that you're struggling. And I say that all the time because it's so important. It's not to suffer in silence. It's being able to have an open conversation with someone and share what you're going through. And that could be the stepping stone for you to get better on your recovery. And that's really important. It could be the smallest step you take that could have that compound ripple effect over time, that you're living a happy, fulfilled life, and whatever which way that looks. I think that would be my thoughts on it, really. Just there's plenty out there, plenty services, plenty organizations, but it's taking that first step. Yeah.
Well said. Michael.
Yeah, I think Cillian's just kind of hit everything on the head there. Again, the first thing I would recommend is GP, whatever, accessing the services that are available to you. Again, if that's something that a step that you're not willing to take, a friend, someone just that you can open up to speak to. As long as you're talking, it is going to help, and that's the main thing, And I feel like as long as you're speaking to someone, there's always going to be somebody there just looking out for you, and that's kind of the main thing you need. But again, it's the GPs, it's the access services, your organizations that's around you. Anybody at all that kind of works around mental health is they're the places to look at, So
yeah. Well said, Michael. Well said. And I would just add to what the two of you said, definitely GP first protocol. And if there's referrals, say, on to mental health services, and there's a waiting list, don't feel that you have to sit and wait. There's always community groups while you're waiting. There's some fantastic community groups out there that deal in the area of mental health. You have Grow and you have Aware. You have Pieta House. You have Samaritans, that are well used to dealing with people that are just feeling overwhelmed, or even having thoughts of suicide. And as the two lads said, I would thoroughly back up. Chat to someone that you know, or anyone at all. If you're very private, get over that kind of uncomfortable feeling of stigma, really, of talking about it, and take action. Okay. Well, what I would like to do now is just check to see, lads, on questions. don't you two go anywhere, but just in case they're hard questions, I can field them over to you. Okay.
And Claire in the background is answering some of them there anyway.
Claire has. Have you looked into programs like React? That's from Tom.
Yeah, I think Claire has covered all the questions.
Oh, she's covered all the questions.
Yeah.
All right. Well, anyway, with a few more
it.
minutes. Is there anything else that we haven't covered that any of you want to kind of bring up?
Happy enough now, to be honest. Yeah, I think we've covered a lot in the space of time,
Yeah.
Great conversation.
Here's one here I kind of noted earlier on when I was reading through. Higher positive mental health is more likely among men than women. Higher positive mental health is more likely among men than women.
Is that a question or is it a stat?
Oh, that's a stat. That's a stat coming from I think it's Healthy Ireland survey 2015. So what I'm posing to you is, do you agree with that, or do you disagree, and why? If either way, which what is it that's making you either agree or disagree? Higher positive mental health is more likely among men than women.
Yeah, I thought it would have been the other way around. I thought like men's mental health would be worse. I suppose maybe that's just a lot of what I see. Like I know within the traveller community, like the deaths due to suicide is a lot higher for men. So the men between 15 and 25 is some of the highest ages that we see for suicides. Like again, when you look at the percentage of women in that there, it's very low. Like, but again, that's just kind of from my work. But
Cillian?
I'd just like to see more information on it rather than the statement. It's hard to answer it without much more kind of data or information on it, really.
From what I remember, there was about, say, 1,500 people surveyed.
Yeah.
And then from their own answers back, that's what came out. I would go along with what Michael said there. I would not that I would disagree with it, obviously, survey, but I would say that the men just didn't want to show their cards, so they were just taking, I'm grand. I just find it kind of strange. I think it's like we talked about earlier. It's like a language that men find very hard to talk about.
Yeah, it goes back to the men just finding it harder to open up and speak about those things, I think.
Yeah. But it's
just
interesting.
There's just a question in on the Q&A there. If you, it's about if you want to tackle it, and we might do the mindfulness part then after that.
Oh yes. Any tips for anxiety, especially social anxiety? Good question. That's a big topic. Social anxiety. Well, I'll go first. I would have bother with social anxiety myself at times, and what helped me is I go to grow. I journal when I can. Recently, as I said, I did stress control, which is a course. If you just Google stresscontrol.org, I found that helpful. So that'd be some of the things I'd find helpful.
Yeah, and I think just to tie on that, I know Michael mentioned headspace, but meditation for me really just grounds me in the moment and lessens the anxious thoughts that I may get from time to time. I use Insight Timer, and there's a range of different meditations on that. So when I do get a bit nervous or anxious or whatever, I might just try that for 5 to 10 minutes, even less, even a couple of breaths. We'll do a mindfulness piece in a couple of minutes. So just to kind of give you an idea of what that looks like for those of you that haven't tried meditation before. So that really helps me, just trying to help in the situation. So Michael, I don't know if you want to.
Yeah, look, I suppose when it comes to kind of like going out and into and doing things, I'd have a lot of social anxiety though, but again, I like to play a lot of sports and I like to kind of stay fit. So if I'm trying something new, if I'm going into a new area where I don't know people, like if I have a friend there that's into that stuff too, I used to tell him, oh, well, I'm going to this, do you want to come with me? Like I'll try and bring someone with me and kind of, because they might be a bigger talker than me and they'll get me in there and then I'll start kind of slowly getting more comfortable. But I can find it tough sometimes going into situations by myself. But again, if you have somebody else there with you, it can be a great support too as well. So
Good.
Brilliant.
Cheers, lads. I hope
And
that helped.
just to give Claire, Development Officer with Mental Health Ireland as well, she's in the background answering the Q&A questions as well, so it's great to have her there as well. So much appreciated, Claire.
Yes, thanks a million. Thanks a million, Claire.
We might move on to the meditation piece, Bill, if that's okay.
Certainly.
Perfect. So I just invite attendees and the panelists to just ground yourself in the moment. I suppose plant your feet into the floor. You can close your eyes for the next, I suppose, 2 to 3 minutes. And just begin by taking a big, long, deep breath in. Filling your lungs with fresh air and slowly exhaling. Continue to breathe, releasing any tension or stress. Just feel your body relax completely, feeling the weight of your body sinking into the support beneath you. Now bring your attention to this moment. Take a moment to become aware of the sensations in your body and feel the points of contact where your body connects with the surface beneath you. Notice any feelings of the air against your skin, the temperature, and any movements or sensations in the body. Now shift your attention to your breath and just feel the rhythm of your breaths flowing in and out. Just notice the natural rise and fall of your abdomen, or the sensation of the air passing through your nostrils. Let your breath be the guide, anchoring you to this present moment. Now expand your awareness to any sounds around you, any distant sounds, any sounds within your own body. Allow these sounds to come and go without any judgment. I'd like you to bring yourself inward. Notice any thoughts or emotions that are arising in your mind. Observe them again, passing like clouds in the sky without any judgment. Now I'd like you just to scan your body from head to toe. Start at the top of the head, noticing any areas of tension or discomfort. Take a moment to bring yourself into this moment again, observing thoughts and any physical sensations in the body. As we come to the end of this meditation, take a deep breath in and a long exhale out, releasing any more tension or stress. When you're ready, slowly come back into the room again. Give yourself a moment. And hopefully you all enjoyed that. I'll just invite the panelists back on again. That's all right.
That was great. Thanks, Cillian.
No worries. No worries. Hope you enjoyed it. Yeah, and hopefully the attendees enjoyed it as well. That's great.
Yeah.
So we're just nearly at 3 o'clock there. Claire, I don't know if you want to share just the end slides again, and I'll run through. I suppose, Bill, you want to do a wrap up as well. So will I do this, the sharing the Midwest Aries events, and then we can all say or do a wrap up then? Would that be okay?
Yeah, sure.
Perfect. Thanks, Claire. So this is our webinar for the end of July. So it is coping with summertime blues. So I think it's going to be a really good discussion as well. So it's usually the last Wednesday of each month anyway. So the last Wednesday at 2 p.m. to 3 p.m. So if you'd like to book onto that, it's the Midwest Aries Eventbrite page, probably the same link or same page that got you onto this webinar as well. So that's coming up the end of July. We also have our online workshop timetable for July. So we have a range of different workshops. The first one there is managing well-being and mental health recovery, exploring anxiety, managing anxiety, and how can I find meaning in my life and feel more empowered. So they're all booked on Eventbrite as well. But if you want to email me, Cillian.Keane@hsc.ie as well, if you'd like to book. And the last two there is creativity for well-being on the online one, and self-care, building my resilience. Then we have, sorry, thanks a million, Claire. We have our creativity for well-being workshop in the Lighthouse in the partnership with West Clare Mental Health Association. That's the poster there on the screen. So that's on the 13th of July, 10:30 to 1 o'clock. And the booking link is through James Fenley. It's on the poster there. But I'll be sending this out in the learner pack anyway on Friday. So you'll get all the information if you'd like to book onto that. If you are based in the Clare area or Kilrush area, or even around the outskirts of it as well. So it'd be great to have you attending those workshops. So Bill, I'll pass it back to yourself. That's okay. Thanks, Claire.
Yeah, I'm very impressed with all that there, Cillian.
Yeah, lots going on.
I might take a tent and go down to the Midwest for the rest of the summer.
Definitely. Lots of nice areas around Clare.
We have, you know, obviously we've recovery stuff going on in Donegal, but not under the kind of the recovery colleges umbrella, which is unfortunate. Like, and just when you see all that kind of stuff going on, it makes you feel a wee bit jealous. But hopefully down the line we'll get it all kind of coordinated. Good luck with all that. That sounds fantastic. Thanks everyone for joining us. I would like to thank Cillian, and I'd like to thank Michael for joining me too, and working a wee bit harder than probably expected to, because we were to have Paul Gibson on from Grow, but I don't know, Paul must have had technical bother of that coming on, because he was all set there before we came on. So anyway, thank you very much, lads, for a great chat. And my summing up of it is, you know, things aren't too bad for men in Ireland today. You know, the positives were very positives, and the challenges from listening to the two of you were very doable, and are getting done, which is fantastic. So the future looks bright. Okay, so thanks again, everyone, for joining us, and we'll see you all at the next one.
Yeah, I just put a feedback form in the chat there as well for anyone that is attending and would like to add to the feedback form and just give her your thoughts and experiences of the day today. It'd be great. So it's just in the chat if you have a look there, and it'd be sent out in the learner pack on Friday anyway, so you'll have it there as well. So thanks a million, everyone, and sure, we'll chat to you at the next webinar next month. Thanks a million.
Bye.
Bye.